Have you ever had a pimple on your eyelid? The actual medical term for this is actually called an internal hordeolum, otherwise known as a stye. Stye is actually an infection of the glands within our eyelids. We have glands that actually line our lower eyelid as well as our upper eyelid. The tear film in your eye consists of mucus, water, and oil. The oil layer is incredibly important because it prevents the evaporation of our tear volume, and without that oil, we'd have chronic dry eye symptoms. It's the meibomian glands that line our eyelids that create this oil that's so incredibly important for our tear volume. A stye is actually a blockage and an infection of these oil glands, which can be very painful, very tender, and if they become large enough, they actually can obscure part of our visual field. Now, when patients get a stye, their first instinct is to squeeze the gland and try to get rid of it, much like they would do like a pimple on their skin. And that is a big no. You do not want to do that because if you squeeze it, it's a pocket of bacteria in there that actually then can migrate into the adjacent tissue and ultimately developing a cellulitis. It can be very significant if it migrates to the back of the eye and cause extreme health issues that could potentially require hospitalization. So if you do get a stye, this is what you're going to do.
Try applying a warm compress.
And this can be accomplished by washcloths or even tea bags. So the tea bag will actually conform to the surface of the eyelid, and you want to try to do that for about 10 minutes and do that 3 to 4 times a day.
Another thing you should try is massaging the gland.
You can just use your knuckle, and if it's your lower eyelid, you would like to massage that gland and actually encourage it to go up, or the upper eyelid, massage it, encourage it to go down to try to get the oil flowing through that gland. Along with the warm compresses, we recommend doing lid scrubs. And what lid scrubs are, you can actually do that as simple as using Johnson & Johnson's baby shampoo in cleansing the lid margin, or even over the counter, you can find lid wipes. And there's multiple different companies that make lid wipes, and you can just cleanse that eyelid, the eyelashes, and that lid margin to remove the bacteria from the surface. Now, these infections can be stubborn at times, and they just will not go away with warm compresses and massages. And that's when you're going to come into the clinic and I'm going to see you. There's a good chance that we will actually prescribe you an antibiotic. Now, occasionally, even with maximum medical therapy, we do not get resolution of the stye. At that point, we will have that patient see an ophthalmologist where they will actually do an incision and a drainage procedure where they actually can resolve the stye. So hopefully you never get a hordeolum or a stye, and whatever you do not squeeze it, because that's going to cause a world of problems. And if those other techniques don't work for you, come in and see us. We're happy to see you.